I am Dr. Sinjab. This is part 3 of the Concepts in Refractive Surgery course. In this part, I am going to discuss a very common problem. That is, determining the astigmatism that should be treated by refractive surgery in case of a difference between the manifest and the topographic astigmatism. As you will see, the difference can be in terms of axis, amount, or both. Although you are going to be confused by the many probabilities, but at the end, you will find the solution is very easy, and the treatment options will be ruled by a few robust guidelines. As usual, I am going to use my systematic step-by-step approach supported by clinical examples. I hope you will enjoy. Concepts in Refractive Surgery Part 3 Astigmatism Problem. There are two types of astigmatism, the manifest astigmatism and the tomographic astigmatism. The manifest astigmatism is defined by the amount of astigmatic correction that the eye needs to see optimally and comfortably. So we have to concentrate on these three keywords: needs, optimally, and comfortably. And this is true if we want to prescribe glasses or contact lenses. But in refractive procedures, the definition becomes the amount of astigmatic correction that the eye must have to see optimally. So we have must have and optimally. There is no needs and no comfortably. Why? Because we are working in the plane of the cornea. In addition, the manifest astigmatism may not be determined from the first visit and may need cycloplegic refraction, and then may need a gradual approach in order to reach the best and optimal amount of manifest astigmatism that should be treated. What about the tomographic astigmatism? The tomographic astigmatism can be measured by three ways: true net power map, total corneal refractive power map, or the algebraic sum of the amount of astigmatism of the anterior and posterior corneal surfaces. The easiest way is to calculate the algebraic sum. We look at the amount and axis of astigmatism on both anterior and posterior corneal surfaces. The axis of both anterior and posterior astigmatism should be parallel in order to be able to calculate the algebraic sum, as in this example. Now, both manifest and tomographic astigmatism can be with the rule, against the rule, or oblique astigmatism. Now, what is the definition of with the rule astigmatism? We can say that the astigmatism is with the rule when the steep axis is vertical between the 80 and 100 degrees axis, and it is against the rule when the steep axis is between the 10 degrees and 350 degrees, or between 170 and 190, or in other words 180 plus minus 10 degrees, and it's oblique otherwise. So with the rule, when the steep axis is at 90 plus minus 10 degrees, and against the rule when the steep axis is 180 plus minus 10 degrees, otherwise it is oblique. It's very important, before we start studying the problem of astigmatism, we have to adjust both manifest astigmatism and topographical astigmatism to have minus sign. Both should have minus sign. As in this example, we go to the settings in the camera, and we have to adjust the astigmatism to be displayed in minus. And we have to adjust the manifest refraction in order to convert the plus astigmatism into minus astigmatism, and in this way we can compare both axes whether they are in same direction or in opposite directions. So, we can classify the problem of manifest astigmatism, topographic astigmatism disparity into same direction and different directions. In the same direction, both axes are within plus minus 10 degrees from each others. For example, the manifest astigmatism is at 180 and the topographic astigmatism is at 170. Both are within the rule and the difference between them is 10 degrees. So they are classified as same direction. The other example is manifest astigmatism is at 82. The topographic astigmatism is at 100. Both are against the rule and they are of same direction because the difference is 8 degrees. This is a case of oblique astigmatism for both manifest and topographic astigmatism, but both are of same direction because the difference is 9 degrees. The other subclassification is the different directions, where the angle between the two astigmatism is more than 10 degrees. For example, the manifest astigmatism is with the rule 180 and the topographic astigmatism is at 90, so it is against the rule. The difference between them is 90 degrees, so they are perpendicular. Another example, manifest astigmatism at 30, topographic astigmatism at 125. Another example, manifest astigmatism at 75, topographic astigmatism at 20. Now, in all cases of manifest topographic astigmatism disparity, we have to exclude misalignment during taking the capture, corneal irregularities including form frost keratoconus, tear film disturbance, corneal opacities, and the most important is the lenticular astigmatism, especially early cataract. Now, in terms of guidelines of treatment, we can say that there are 6 probabilities under the name of same direction and only 1 probability under the name of different directions. Of course, there are so many probabilities under the name of different directions, but in terms of treatment, all of these probabilities have the same rule of treatment. Regarding same direction, there are 2 probabilities under with the rule astigmatism, 2 probabilities under against the rule astigmatism, and 2 probabilities under oblique astigmatism. Now we will start discussing each probability in depth. Probability number 1. Both manifest and topographic astigmatism are with the rule, but the manifest astigmatism is less than or equals to topographic astigmatism. Like in this example, manifest is -2 at 180 or +2 at 90, and the topographic is -3 at 180. Probability number 2, still both manifest and topographic astigmatism are with the rule, but the manifest astigmatism amount is larger than that of the topographic astigmatism. For example, the manifest astigmatism is -3 at 180 or +3 at 90, while the topographic astigmatism is -2 at 180. Probability number 3. Both manifest and topographic astigmatism are against the rule, but the manifest amount is less than or equals to the topographic astigmatism. Like in this example, manifest is -2 at 90 or +2 at 180, and the topographic is -3 at 90. Probability number 4. Both manifest and topographic astigmatism are against the rule, but the amount of manifest astigmatism is larger than that of the topographic astigmatism, like in this example. Manifest is -3 at 90 or +3 at 180, and the topographic is -2 at 90. Probability number 5. Both are oblique in the same direction, but the manifest astigmatism, the amount of manifest astigmatism is less than or equals to that of the topographic astigmatism. Like in this example, the manifest is -2 at 40 or +2 at 130, and the topographic is -3 at 40. Probability number 6. Both are oblique, and the amount of manifest astigmatism is larger than the amount of topographic astigmatism. Like in this example, manifest is -3 at 40 or +3 at 130, and the topographic is -2 at 40. The other subclassification is the different directions. All of these probabilities will be gathered under one probability. It is probability number 7. Why? Because all of these probabilities will be ruled by only one guideline of treatment. But I will discuss all the probabilities as follows. Probability 7A. Manifest astigmatism is with the rule and equals to or less than the topographic astigmatism, which is against the rule. As in this example, manifest is -2 at 180 or +2 at 90, while the topographic is -3 at 90, and they are perpendicular to each others. 7b, still the same, but the amount is, of the manifest astigmatism is larger than that of the topographic astigmatism. Like in this example, manifest is -3 at 180 or +3 at 90, while the topographic is -2 at 90. 7c, still both of them is perpendicular to each other, but in this case the manifest is against the rule and the topographic is with the rule, and the amount of manifest is less than or equals to the topographic astigmatism. As in this example, the manifest is -2 at 90 or +2 at 180, and the topographic is -3 at 180. 7d, still the same, manifest is against the rule, topographic is with the rule, but the amount of manifest is larger than the topographic. Like in this example, the manifest is -3 at 90 or +3 at 180, and the topographic is -2 at 180. In 7e, both are oblique but still perpendicular to each others. The difference is almost 90 degrees, and the manifest astigmatism, the amount of manifest astigmatism is less than or equals to the amount of topographic astigmatism. For example, manifest is -2 at 40 or +2 at 130, while the topographic is -3 at 130. In 7f, the same situation, but the amount of manifest is larger than that of the topographic. For example, -3 at 40 for the manifest and -2 at 130 for the topographic. The final probability is 7g, where they are not perpendicular to each others. They have different angles and different amounts. Treatment guidelines. Although you have seen a lot of probabilities and you may have been confused by these probabilities, but you will find the case is very easy and very simple, because all of these probabilities are ruled by 3 guidelines. In the same direction, subclassification, there are 2 rules. The first one is, do not convert topographic astigmatism from with the rule into against the rule. And the other one is, you can convert topographic astigmatism from against the rule to with the rule, but within 1 diopter. And we will study later a lot of examples to explain these 2 rules. In the different direction subclassification, we have only one rule. Adjust the spherical equivalent with the least astigmatism, if any, and plan for enhancement. Now let's study each probability in detail and have some examples. Probability number 1. If we have manifest astigmatism and topographic astigmatism, both are with the rule, but the manifest astigmatism is less or equals to topographic astigmatism, like in this example, then we have only one option of treatment. Actually, this situation is the most common one that we encounter in our clinical practice. The one option is just very simply is to treat the manifest astigmatism. And in this way, we will obtain a postoperative manifest refraction equals 0, while the topographic astigmatism will be reduced, like in this example. It becomes -1 at 180, so it is still with the rule. We have not converted it into against the rule, and we have reduced the amount of topographic astigmatism, and we have corrected all the amount of the manifest refraction. So this case is straightforward. For example, a patient has manifest refraction of -2 sphere, -2 cylinder at 180, topographic astigmatism -3 at 180. If we correct manifest refraction, postoperative manifest refraction will be 0. Postoperative topographic astigmatism will be -1 at 180, which is with the rule. Example B. A patient has manifest refraction of +1 sphere, +1 cylinder at 90, and topographic astigmatism of -1.75 at 180. First, we have to convert the manifest refraction equation into the minus cylinder. So it becomes +2 sphere -1 cylinder at 180. So both are same direction, both are with the rule astigmatism. So if we correct manifest refraction, the postoperative manifest refraction will be 0, and the postoperative topographic astigmatism will be -0.75 at 180, which is with the rule astigmatism, and the case is straightforward. So the rule says when the manifest astigmatism is less than or equals to topographic astigmatism and both are with the rule, treat manifest astigmatism. Probability number 2. The manifest astigmatism and the topographic astigmatism are with the rule, but the amount of manifest astigmatism is larger than the amount of topographic astigmatism, as in this example. The manifest is -3 at 180, the topographic is -2 at 180. Let us study now the options of treatment. There are two options. The first option is to treat the manifest astigmatism. But unfortunately, if we do this, we will convert the topographic astigmatism from with the rule into against the rule, although we have obtained a 0 manifest refraction postoperatively. Now, this will be, the patient will not tolerate this situation, because we have converted his topographic astigmatism from with the rule, which was native for him, into against the rule, which is very odd to his brain. So the other option is to treat the amount of topographic astigmatism, and in this way we will reduce the amount of manifest astigmatism, and we will have a 0 topographic astigmatism. But in this case, we are not correcting the full refraction that should be treated of the patient. So what is the solution? Actually, the rule says correct topographic astigmatism and add half the difference to sphere. In other words, we have to adjust the spherical equivalent. For example, a patient has manifest refraction of -1 sphere, -3 cylinder at 180, and his topographic astigmatism is -2 at 180. As we see here, the amount of manifest astigmatism is larger than that of the topographic astigmatism. Both are with the rule. So in this case, the difference is 1 diopter. We add half diopter to the sphere, and we are going to correct -1.5 sphere, -2 cylinder at 180. In this case, we are treating the same spherical equivalent, and we are not converting the topographic astigmatism from with the rule into against the rule. Let's have this example. Example A. A patient has manifest refraction -2 sphere, -3 cylinder at 180, topographic astigmatism -2 at 180. If we correct manifest refraction, we will convert the topographic astigmatism to be -1 at 90, which is against the rule. So the solution is to correct -2.5 sphere, -2 cylinder at 180. As you see here, we are going to correct the topographic amount, and we are compensating for the remaining amount of manifest astigmatism by adjusting the spherical equivalent. In this way, the postoperative spherical equivalent will be 0, and the topographic astigmatism will be 0. Example B. A patient has +1 sphere, +2.5 at 90, and a topographic astigmatism of -1.5 at 180. Of course, we have to convert the equation of the manifest refraction, and it will be +3.5 sphere -2.5 at 180. So both are with this with the rule, but the amount of manifest astigmatism is larger than that of the topographic astigmatism. So if we correct the manifest, we are going to convert the topographic astigmatism to be against the rule, and the patient will be very annoyed. He cannot tolerate this. So the solution is to correct +3 -1.5 at 180. The -1.5 is the amount of topographic astigmatism, and the remaining, which is 1 in comparison with the manifest astigmatism, half of it has been added to +3.5, and we are going to correct the same spherical equivalent. So postoperatively, we will have postoperative spherical equivalent of 0, and the topographic astigmatism will be also 0. So the golden rule is, when manifest astigmatism is larger than the topographic astigmatism and both are with the rule, treat the amount of topographic astigmatism and compensate for the spherical equivalent. Probability number 3. In this probability, which is not uncommon, the manifest astigmatism and the topographic astigmatism are against the rule, but the amount of manifest is less than or equals to the amount of topographic astigmatism, as in this example. Now we have only one option. If we treat the manifest astigmatism, we are going to reduce the topographic astigmatism, and the postoperative manifest refraction will be 0, and the postoperative topographic astigmatism will stay against the rule and has been reduced by the amount of it has been reduced. Let's have an example. Example A. A patient has manifest refraction of -0.5 sphere -1 cylinder at 90, and his topographic astigmatism is -1.75 at 90. So as you see, both are against the rule, but the amount of manifest is less than that of the topographic. So if we correct the manifest, we are going to have post-operative manifest refraction of 0, and the amount of topographic astigmatism will be reduced, and it will be against the rule. So this case is also straightforward. Example B, manifest refraction is +2 sphere plus 1.5 cylinder at 180. Topographic astigmatism is -2.25 at 90. We have to use the minus cylinder equation, and if we correct the manifest refraction, we are going to reduce the topographic astigmatism, and it will stay against the rule, and the manifest refraction will be 0. So the rule says when manifest astigmatism, the amount of manifest astigmatism is less than or equals to the amount of topographic astigmatism, and both are against the rule, just treat the manifest astigmatism. Probability number 4. This probability is also not uncommon. Both are against the rule, but the amount of manifest is larger than the amount of topographic astigmatism, like in this example. So let us study the options of treatment in this case. We have two options. The first option is to treat the topographical astigmatism, and in this case, we are going to decrease the amount of manifest astigmatism. We are not treating the manifest astigmatism completely, and we are going to have post-operative topographic astigmatism of 0. Or the other option is to treat the manifest astigmatism, and in this way we are going to convert the topographical astigmatism from against the rule into with the rule. As in this example, the manifest refraction, post-operative manifest refraction will be 0, while the topographic astigmatism will be -1 at 180. So what is the solution? We can divide this case into two categories. When the difference between the manifest astigmatism and topographic astigmatism equals to or less than 1 diopter, or when the difference is larger than 1 diopter. Now, when the difference is less than or equals to 1 diopter, just correct manifest astigmatism. And if the difference is larger than 1 diopter, correct the topographical astigmatism, added to it -1, and compensate for the remaining by spherical equivalent. And we will study examples to explain these two rules. Now the first one, the difference is less than or equals to 1 diopter. We have to correct the manifest refraction. The manifest refraction is -1, -4 at 90, for example, and the topographic astigmatism is -3 at 90. So the difference is 1. If we correct manifest refraction, we are going to convert the topographic astigmatism from against the rule into with the rule, and it will be -1 at 180. In this case, the patient will be happy. It is tolerable because it is with the rule astigmatism, but should be within 1 diopter. So if you remember, one of the guidelines says you can convert with the rule, you can convert against the rule into with the rule, but within 1 diopter. Now the other situation is when the difference is larger than 1 diopter, we have to correct topographic astigmatism plus -1 and compensate for the remaining by spherical equivalent. For example, manifest refraction is -1 sphere, -3.5 at 90, while the topographic astigmatism is -2 at 90. So the difference is more than 1 diopter. If we treat the manifest refraction completely, in this case we are going to convert the topographic astigmatism into -1.5 at 180. Although it is with the rule, but it is more than 1 diopter and it will be intolerable. So what we are going to do is we are going to treat -3 cylinder, meaning that we are adding -1 to the topographic astigmatism, and the remaining is minus 0.5 in comparison with the manifest astigmatism. So half of it will be added to the sphere in order to obtain the same spherical equivalent. So the final treatment will be for minus 1.25 sphere minus 3 cylinder at 90. And in this case, the postoperative spherical equivalent will be 0, and the postoperative topographic astigmatism will be minus 1 at 180, which is with the rule astigmatism and within 1 diopter. So the golden rule says when manifest astigmatism is larger than topographic astigmatism and both are against the rule, treat manifest to convert topographic astigmatism into with the rule but within 1 diopter. Probability number 5. The manifest astigmatism and the topographic astigmatism both are oblique but in the same direction, and the manifest astigmatism is less than or equals to topographic astigmatism. For example, the manifest is minus 2 at 40 or plus 2 at 130, while the topographic is minus 3 at 40. We have only one option. This option is to treat the manifest astigmatism. In this way, we are getting rid of the manifest astigmatism, so the post-op manifest astigmatism will be 0, and we are reducing the topographic astigmatism, which stays in the same direction. So we are not converting this topographical astigmatism. For example, a patient has manifest refraction of minus 0.5 sphere minus 2 cylinder at 120, and his topographic astigmatism is minus 2.75 at 120. So if we correct the manifest refraction, the post-op manifest refraction will be 0, and the topographic astigmatism will be reduced to be minus 0.75 at 120, which is oblique and not converted. It is in the same direction. Another example, manifest refraction plus 0.5 sphere plus 2 cylinder at 130, and the topographic astigmatism is minus 3 at 40. Of course, we have to convert the manifest refraction to be in the minus cylinder. Now, as we see here, both are oblique, but they are in the same direction, and the amount of manifest astigmatism is less than the topographic astigmatism. So if we correct the manifest refraction, the post-operative manifest refraction will be 0, and the topographic astigmatism will be reduced, and it will be oblique but in the same direction. So the golden rule here says when manifest astigmatism is less than or equals to topographic astigmatism and both are oblique in the same direction, just treat the manifest astigmatism. Probability number 6. Both are oblique in the same direction, but the manifest astigmatism amount is larger than that of the topographic astigmatism. Like in this example, the manifest is minus 3 at 40 or plus 3 at 130, and the topographic is minus 2 at 40. Now let's study the options of treatment. The first option is to treat the manifest astigmatism, which is minus 3 at 40. In this case, we are going to convert the topographic astigmatism to be minus 1 at 130. Or we treat the topographic astigmatism, and in this case, the topographic astigmatism after the operation will be 0, while the manifest astigmatism will be reduced, but still the patient will have some manifest astigmatism. So what is the solution? The golden rule here says when manifest astigmatism is larger than topographic astigmatism and both are oblique in the same direction, treat topographic astigmatism and compensate for the spherical equivalent. And we will study two examples. Example A. A patient has manifest refraction minus 3.25 sphere minus 2 cylinder at 120. The topographic astigmatism is minus 1.5 at 120. So both are oblique, but in the same direction. And the amount of the manifest astigmatism is larger than that of the topographic astigmatism. So in this case, I'm going to treat the topographic astigmatism, which is minus 1.5, and the difference, which is 0.5 in comparison with the manifest astigmatism. Half of it will be added to the sphere in order to obtain the same spherical equivalent. So I will treat minus 3.5 sphere minus 1.5 cylinder at 120. In this case, the postoperative spherical equivalent will be 0, and the postoperative topographic astigmatism will be 0. Another example, a patient has manifest refraction plus 2.5 sphere minus 1.5 cylinder at 130, and his topographic astigmatism is minus 1 at 130. So in this case, I'm going to treat plus 2.25 sphere minus 1 cylinder at 130. As you see here, I choose to treat the topographic astigmatism, which is minus 1, and the difference between the topographic and the manifest is 0.5. Half of it will be added to the sphere in order to obtain the same spherical equivalent. In this case, the postoperative spherical equivalent will be 0, and the topographic astigmatism also will be 0. Probability number 7. We will take one of the examples under this probability. The case where the manifest astigmatism is with the rule and the topographic astigmatism is against the rule, so both are perpendicular, and the manifest astigmatism is less than the topographic astigmatism. Now, if I'm going to treat the manifest astigmatism, in this case, I will be increasing the topographic astigmatism from minus 1 to minus 1.75 at 90. So what is the solution? The solution in this case is to recheck the refraction and try to adjust the manifest astigmatism and spherical equivalent with the least amount of astigmatism, if any. For example, a patient has manifest refraction minus 3 sphere minus 1 cylinder at 180, and his topographic astigmatism is minus 0.5 at 120. Now, his best corrected visual acuity with this manifest refraction is 1.0. I will try to reduce the amount of astigmatism and adjust the spherical equivalent, and I found his best corrected visual acuity becomes 1.0 partial when the manifest refraction is adjusted to be minus 325 minus 0.5 at 180. Again, I will try to eliminate the astigmatism, and the manifest refraction will be minus 3.5 to obtain the same spherical equivalent, but his best corrected visual acuity becomes 0.9. So in this case, I will go to the manifest refraction of minus 3.25 sphere minus 0.5 cylinder at 180. I choose this in order to treat, and postoperatively the spherical equivalent will be 0, but I cannot say now what will be the topographic astigmatism because it needs the vector analysis. However, always in probability number 7, we may need enhancement. So the golden rule says, in case of different directions, adjust manifest astigmatism and spherical equivalent with the least astigmatism, if any, and plan for enhancement. So in summary, rule number 1, when manifest astigmatism is less than or equals to topographic astigmatism and both are same direction, treat manifest astigmatism. When manifest astigmatism is larger than the topographic astigmatism and both are with the rule, treat topographic astigmatism and compensate for the spherical equivalent. When the manifest astigmatism is larger than the topographic astigmatism and both are against the rule, treat manifest to convert topographic astigmatism into with the rule but within one diopter. Rule number 4, when manifest astigmatism is larger than the topographic astigmatism and both are oblique in the same direction, treat topographic astigmatism and compensate for the spherical equivalent. So as you see here, rule number 4 is just like rule number 2. Finally, rule number 5. In case of different directions, adjust manifest astigmatism and spherical equivalent with the least astigmatism, if any, and plan for enhancement. Thank you very much. In the next part number 4, I am going to apply the previous 5 rules on some clinical examples. Goodbye.